Hi everyone, Dr. Bruce here. In this video, I will cover some medical terms related to the reproductive system. Let's begin. Amenorrhea. Amenorrhea is the absence of menstruation, often indicating pregnancy, hormonal imbalances, or other underlying medical conditions. Amniocentesis. Amniocentesis is a prenatal diagnostic test that involves extracting a small amount of amniotic fluid to assess fetal health and detect genetic conditions. Cervical dysplasia. Cervical dysplasia is the abnormal growth of cells on the cervix, often detected through pap smears and associated with an increased risk of cervical cancer. Colporrhaphy. Colporrhaphy is a surgical procedure to repair and strengthen the vaginal wall, often performed to address vaginal prolapse. Colposcopy. Colposcopy is a procedure that uses a specialized magnifying device to examine the cervix and vaginal tissues for signs of abnormality. Dysmenorrhea. Dysmenorrhea is painful menstruation, often caused by uterine contractions and cramping. Endometriosis. Endometriosis is a condition in which tissue similar to the lining of the uterus grows outside of the uterus, often causing pain and fertility issues. Episiotomy. Episiotomy is a surgical incision made in the perineum, area between the vaginal opening and anus, during childbirth to ease delivery and prevent tearing. Fibroadenoma. A fibroadenoma is a non-cancerous breast tumor made up of glandular and fibrous tissue. Hysterectomy. A hysterectomy is a surgical procedure to remove the uterus, often performed to treat conditions like uterine fibroids, endometriosis, or cancer. Hysterosalpingography. Hysterosalpingography is a diagnostic imaging procedure that involves injecting a contrast dye into the uterus and fallopian tubes to assess their structure and function. Hysteroscopy. Hysteroscopy is a procedure that uses a thin, lighted tube to examine the inside of the uterus and diagnose or treat various conditions. Mastopexy. Mastopexy, also known as a breast lift, is a surgical procedure to reshape and lift sagging breasts. Menometrorrhagia. Menometrorrhagia is irregular and heavy menstrual bleeding, often accompanied by bleeding between periods. Obstetrician. An obstetrician is a medical doctor who specializes in pregnancy, childbirth, and postpartum care. Oophorectomy. Oophorectomy is the surgical removal of one or both ovaries, often performed to treat conditions such as ovarian cysts or cancer. Orchiectomy. Orchiectomy is the surgical removal of one or both testicles, often performed to treat testicular cancer or reduce hormonal production. Orchiopexy. Orchiopexy is a surgical procedure to reposition an undescended testicle into the scrotum to promote normal growth and development. Salpingo-orophorectomy. Salpingo-orophorectomy is a surgical removal of the fallopian tubes and ovaries, often performed to treat conditions like ovarian cancer. Vasovastostomy. Vasovastostomy is a surgical procedure to reconnect the vas deferens after a vasectomy, aiming to restore fertility. I sincerely hope this video has helped you learn these medical terms. Thanks for watching, and see you next time.